So we're really, really happy to welcome you all to tonight's webinar on behalf of NHMA Florida chapter, Vaccinate for All, Risk Less, Do More, and the American Society for Meningitis Prevention. We are very happy to see you all here. Today's webinars will be addressing vaccine hesitancy in Latin American immigrant communities with a special focus on flu, COVID, and meningococcal meningitis. So very, very important topic, particularly now that we're starting the respiratory season. And of course, talking about such a catastrophic disease that can be meningococcal meningitis as well. So I am Luis Isea. I'm an internal medicine physician in Orlando, Florida. I am one of the co-chairs of the NHMA Florida chapter, and I will be one of your moderators this evening. And I have the pleasure of being joined by Serguei Castaneda. Serguei.
Hey, how is everyone doing tonight? So glad that we're able to join. So glad that we're going to be talking about very important topics today, and we'd like to make it relevant to our communities, to our providers, to everyone that can benefit from prevention. And I think that includes every single one of us. So I'm grateful to be here. Let's kick it off.
Perfect. And then to kick it off, we have some minor housekeeping items. Remember, this is a Zoom webinar. Therefore, all of your microphones are muted. We will start with some brief introductions, and we have an amazing group of panelists actually, and so we'll go briefly with their introductions. Please use the box that you have there at the bottom if you want to submit any questions. We'll keep an eye on those throughout the event as well, and we'll have a few minutes at the very end to go over those questions. We'll also guide you through the presentation, through the whole session. At the very end, you'll have a survey. Very important, please complete the survey. There is a QR code that you're going to see there. You're also going to get an email, and we even have some prizes if you complete the survey. So please do. We want to see how we can be more effective and provide very, very good content to all of our members. And this webinar is being recorded. The recording and the slides will be sent out to all the attendees, and it's also going to be available in our YouTube channel and our website, nhmamd.org. And just as a very brief comment, maybe Sergei, if you want to help us, talking a little bit about NHMA.
Absolutely. So the association has been represented Hispanic physicians for more than 30 years. And more importantly, it has been extended to not only physicians, but healthcare providers. So nurses, pharmacists, and other people within our community can benefit now from many activities, education, advocacy campaigns, and many, many other activities that go for members of the association. For NHMA, we have been divided in chapters, which are geographical, and they tend to be either by city, region, or particular states. And we have the fortune to have many Hispanics within Florida, including Miami, Orlando, and many other towns. And we decided to put our efforts together and create a chapter. And we're happy to synergize with people nationally, locally, and globally. And we like to extend a big network of people that can benefit from working together to benefit their community. So very, very, very glad to be part of this group.
Thank you. And actually, the picture that you see there is from our annual conference earlier this year, all the series of pictures. And it was an amazing annual conference. So we're going to talk a little bit about that towards the end. Now, if, NHMA, one of the biggest things or one of our biggest priorities at a national level and on a state level is to work raising awareness on immunizations. And right now we have partnered with different organizations to go forward with 3 big immunization campaigns that you see over here in the slides: Vaccinate for All, Risk Less, Do More, and a general overall flu, RSV, and meningitis education campaign. We're going to talk very briefly about this campaign so that you can all get more information if you want from all of this. And more than that, please join us in being a champion, in being an immunization champion, an educator in the community. All of us as physicians or healthcare providers in general, even if you're a student, a resident, any stage of your career, you have the power to make change in the community. And that's what we want. That's the awareness that we need to work on. So going briefly to our campaigns over here. So we have Vaccinate for All, so vacunas para todos. Our big goal of the campaign is literally to discuss in general about the importance of vaccinations and creating a network of leaders all across the nation so that we can communicate, transmit a message more effectively. If you want more information, there are a couple of microsites that you can visit. So you have vaccinateforall.org and hispanichealth.info. And very important, again, this is tailored to our Hispanic community. Then we have Risk Less, Do More, which is a very big campaign as well that is coming from HHS, for the Department of Health and Human Services. And we want to motivate the uptake, particularly of respiratory vaccines. So flu, COVID, RSV, throughout all the respiratory season that now we're starting, the 2024-2025 campaign. We need to reduce the burden of those respiratory viruses and enhance awareness of the importance of vaccines. And finally, we have our campaign that we have partnered with Sanofi to talk a little bit more and provide education about influenza, RSV, and meningitis. If you see here, we have different strategies. We have a lot of materials that can be used, that can be downloaded, that can be given to your patients, to your friends. So very important to please reach out to us, and we will provide some contact information at the very end. If you want to get more information, you will also be able to see this, by the way, if you go to NHMA.org and the website, some of the websites that we previously mentioned about the first campaign. So why then, without further ado, Serguei, if you want to introduce Dr. Pérez-Stable.
Very good. So Eliseo Pérez-Stable, he's the director of the National Institute of Minority Health and Health Disparities. And so we have all the experience that he provides throughout his career to our disposal tonight to learn more and to basically work together with the rest of our panelists to be a group in which we can learn and share experiences.
So welcome.
Thank you so much for joining us, Eliseo.
Oh yeah, it's a real pleasure to be here, and welcome everybody. I'm delighted to be able to contribute to this effort on the part of the National Hispanic Medical Association. I have to say, I was there when NHMA was created in 1994. It kind of grew out of the group in California that was gathering Latino physicians and medical students. But the Risk Less, Do More campaign from the U.S. Department of Health and Human Services is really to encompass the 3 respiratory viruses that could happen anytime during the year, obviously, but that peak in the winter season when people are spend more time indoors and higher likelihood of transmission. The idea of the campaign is to encourage more people to get vaccinated. We are in the midst of the season already because it's really by the end of October, early November is when you start seeing the cases for influenza tick up. Of course, COVID-19, how can we forget that? And then the new one on the block is RSV, the respiratory syncytial virus, which we always thought was mostly an infection of neonates and young children, but actually it causes about 6,000 to 10,000 deaths in the U.S. among adults who are 65 and over, particularly those with chronic conditions. So we need to, as physicians, as clinicians, healthcare professionals, really create the public confidence in these vaccines. There's been a lot of issues around vaccines, particularly COVID-19, and I won't get into those specifics now. But this is one of the great advances of the 20th century in public health, and it keeps getting better as we get better vaccines, fewer side effects, more efficacy, and we need to really get on board with it. Now, COVID, we know what the burden it caused. And in 2023, the number of people who died from COVID was somewhere around 76,000. Those are preliminary data, way down from 2022, obviously, and I expect it will be way down in 2024 as well. With flu, it's seasonal, and we see anywhere between 10 and 50,000 deaths a year, which are potentially, you can reduce that by a significant amount with the killed virus vaccine that we administer. And it isn't a prevention of flu, just like we learned quickly that we don't prevent COVID infections very effectively, but we prevent severe cases, hospitalizations, and death. And these outcomes are much more likely to occur in older adults over 65, to use an arbitrary age, and people with chronic lung disease and chronic vascular disease, cardiovascular disease, heart disease in particular. And on hesitancy, I can say that in general, when one looks at the data for Latin America, that Latin American countries in general have a high acceptance of public campaigns on vaccines. This is reflected in childhood vaccinations in many countries and increasingly with adult vaccinations, and we saw with COVID. In this country, Latinos, Hispanics are not necessarily less likely to get vaccinated in terms of attitudes or beliefs. There's often a situation of access, either time or ability to go get it. And in case of COVID, if you have no insurance, you have to pay for it. And that's not something a lot of people are willing to do. And there are still some issues with COVID vaccine, as I mentioned earlier. So I'm delighted you're going to hear about this great program, and I look forward to seeing your results.
Thank you so much for providing us such a great insight, Eliseo, and for all the great work that you guys are doing at NIH and as well, particularly in NIMHD with minority health. Really, really appreciate it. So moving forward, we're gonna start introducing our panelists, our speakers for the evening. And we have the pleasure of introducing Ms. Alicia Stillman, the co-executive director for the American Meningitis Prevention Society. Now, Dr. Stillman, it's very, very interesting that we're going to start now talking about meningococcal disease. And you are a dedicated advocate for meningitis prevention, working now with the ASMP, and also as a director of the Emily Stillman Foundation. I know that there is a personal story, partially behind the foundation, behind also all the efforts that you have put in preventing this disease. And thank you so much for being with us. For nearly a decade, so Ms. Stillman has focused on empowering communities to prevent meningococcal meningitis through education, policy initiative, vaccine equity, and she also serves on the World Health Organization's task force to defeat meningitis by 2030. Additionally, Alicia is the CEO of a multi-state law firm and holds degrees from Arizona State University, Wayne State University, and George Washington University with an MBA and an MPH. So thank you so much for being with us today.
Thank you for having me. So I'm going to start off by telling you the story of how I started to do this work, because I wasn't always in healthcare. I started out as a CFO of a law firm. This is Emily. This is my middle daughter. In 2013, my middle daughter called me from college one evening to tell me she had a headache. It was just a headache. I thought she was coming down with the flu. She thought maybe she was overtired because she had been up all night studying the night before. She said the headache was bad. She had an achy feeling. We decided she'd take Motrin and we would see how she felt in the morning. For Emily, the morning didn't come. For Emily, she went to sleep. She woke up a few hours later and she said to her roommates, I think I should go to the hospital to make sure I'm okay. They took her to the hospital, but she walked into the hospital. She was not planning to die. She walked into the hospital with a textbook, her computer, her phone. She was simply going to make sure her headache was okay. Within hours, her demeanor began to change. She began to be confused. She began to be a little combative, and they began to suspect meningococcal meningitis. Since Emily was 19, I was not called until the next morning. When I was called, I was told to get to the hospital right away. I remember telling them that I didn't think Emily could have meningitis, that it wasn't possible because I remembered that she had been vaccinated for meningitis. It turns out that she had received both doses of the ACWY vaccine, which we will talk about, but in 2013, the MenB vaccine was not yet licensed in the United States, so it was not available for Emily to protect Emily. By the time I got to the hospital, she was being prepared for a craniotomy. They told me that the swelling in her brain was so severe that they wanted to lessen the degree of brain damage in case she was to survive. She made it through the surgery, but she never woke up. The swelling never went down. Emily was declared brain dead It was 30 hours only from the time that she made that phone call to me to tell me she had a headache to the time she was declared brain dead. I made the decision for Emily to make her a hero. So she was able to donate 6 organs to 5 people, and she saved countless more lives with bone and tissue. I promised her when I said goodbye on a very, very cold February morning, tubes were coming out of every part of her body. They were keeping her alive to preserve her organs. And I promised her I would figure this out. I would try to figure out how I let her down, what happened, and how I can prevent other families from experiencing this. And I said goodbye. I went back to school. I got my MPH, rolled up my sleeves and got started. And I've done that every day since then in 2013. Next slide. So meningococcal meningitis is the most common form of bacterial meningitis in adolescents and young adults. The bacteria, I'm sure you know, is actually Neisseria meningitis. It's mainly caused by 5 types of meningococcal bacteria, A, B, C, W, and Y. Next slide. The 2 most common types of meningococcal infections are meningococcemia, which is where it stays in the bloodstream, and this infection leads to sepsis. And the other one is meningitis, where the infection is in the membranes that surround the brain and spinal cord. And with Emily, she simply presented with a headache. The meningitis stayed only in her head. And many people ask me, how was she able to be an organ donor? That's how. It never ran through her bloodstream. It never affected her organs. My partner in the American Society for Meningitis Prevention, Patty Wukovitz, her daughter was a high school senior. And when her daughter presented, it was meningococcemia, and Patty saw the rash going up her arms and her legs, and it was different. So it's always really important to note that it kills in a matter of hours, and all symptoms do not have to be present at the same time. Next slide. The symptoms, transmission, and complications of this disease are really important to talk about. The symptoms are a high fever, stiff neck, headache, exhaustion, vomiting, the purple rash I just told you about, like a petechiae. But the important thing to note about the symptoms is it can be one or it could be all. It is a respiratory virus. The bacteria is housed in the larynx, the nasal larynx, and it is asymptomatic in the majority of people who have this bacteria. And why all of a sudden one becomes, symptomatic, we don't know. Emily was healthy when she started, but it is transmitted with respiratory droplets, sharing eating utensils, sharing water bottles, sharing smoking utensils, kissing. Basically the typical behavior of adolescents and young adults. It's very easy to spread from person to person. And like I said, it attacks without warning. It can kill in a matter of hours. 1 in 10 will die, and another 1 in 5 will face permanent complications like limb loss and brain damage. Next slide. The meningococcal vaccinations right now that are available in the United States are into 3 categories. There are ACWY vaccine, which is routinely recommended. It is given at age 11 and again at age 16. Many high schools and colleges require this. The Men-B vaccine was not licensed until 2014. Right now, the recommendation for that vaccine is shared clinical decision-making, and I put that in quotes because that's really a loaded term. Very few colleges and universities require it. In fact, it's only 40-something in the entire United States. And as recently as just a few months ago, we got the first BCWY vaccine, and we are getting the second currently in process. And when the recommendation for that is going to be given at the same time, it can be replaced with when a MenACWY and a MenB vaccine are given together, you can opt to use the MenABCWY vaccine in its place. Next slide. So when should they occur? I pretty much just told you. The MenACWY vaccine is given at age 11 to 12. Then at 16, you have several options. Option 1 would be to be given the new pentavalent vaccine. And option 2 would be given 2 vaccines, the next dose of the ACWY and the first dose of the MenB. And then 1 to 6 months later, we still have to follow that up with the second MenB vaccine. It's a really confusing landscape right now, and the healthcare providers and parents and universities are all confused. So you can imagine that the American Society for Meningitis Prevention, we're very busy. Next slide. So what we do is we attack this as from a public health standpoint by talking to healthcare providers, talking to universities, talking to the adolescents and young adults, talking to the parents, talking to policymakers. And we come at it from all sides because we do believe it takes a village. And we work to empower all people to take action to prevent this horrible disease. We have I think the next slide shows, we have wonderful resources. We have brochures, we have posters, we have videos. Our material is either in English or Spanish, and we are available to speak at any event you are hosting, either virtually or in person. And I urge you to reach out to us with any question. I know I rushed through a lot of very confusing information, but I am going to stay on in case there's questions for at the end. Thank you. The key takeaway for today is to help protect your community from meningococcal meningitis by making sure all young adults and adolescents are vaccinated against all 5 types of meningococcal bacteria that are most likely to cause meningococcal meningitis. I didn't have that ability to do that in 2013, but it's available now. Next slide.
Thank you. Thank you so much for sharing your story, Alicia. It's an inspiration to us all.
Thank you.
I think it's incredible the effort that you're putting out to the community, and I want to speak for myself in the context that we all have to become champions on this, and we all have to continue spreading the word and making that impact, as you mentioned. And particularly, I want to just make a brief remark on the importance of MenB, because we here usually, I'm in primary care, right? I'm an internist. Even though I don't deal with pediatric populations, so we hear, yes, they got all their vaccines and so forth. So when you review it, yes, it's usually the quadrivalent vaccine. But then, maybe I've rarely seen it, if any. So making that emphasis and knowing now that we even have a vaccine that can combine all of them, and maybe further recommendations or new recommendations may come down the pipeline. So this is how we can make a change. So thank you so much for sharing your story.
Thank you.
I agree. That was a very powerful message and resonates to and brings this home to many of us. So I appreciate sharing it. I would like to now introduce Dr. Soler. She is been working in the vaccine program coordinator at Fighting Infectious Diseases in Emerging Countries, FIDEC, which is a nonprofit organization based in Miami, Florida, created in 2001. FIDEC developed programs to fight infectious diseases in Latin America and the United States. And we're gonna benefit today to cover what is the vaccine hesitancy among Latin American groups who live and work in Florida. Dr. Soler, thank you so much for joining us, and continue to share the message.
Thank you so much. I hope you see the slides.
We do.
Okay. Okay. Thank you so much for inviting me to participate in this talk. I would like to share my experience. Well, I always promote vaccination among the Hispanic community. So I have some of maybe things that I would like to share with you regarding the most common reasons why the community may not accept vaccines, as well as some of the strategies that work for me. And I hope they help for you too. So a little bit of the background. So vaccine hesitancy have been around us for a long time, even before the pandemic. It was already declared that vaccine hesitancy was among the top public health threats. And vaccine hesitancy, by definition, is the reluctance or refusal to vaccinate despite the availability of vaccines. So, and this is a time where patients may be more vulnerable to get information out there. Social media may be good information or bad information. And so it may be also an opportunity to educate the community with accurate and scientific information from healthcare professionals or from trusted messengers. So since the pandemic, vaccination rates declined, especially in the children population, and among adults, although increase in some of the vaccines, we are behind the national goal. And looking into ethnic and racial groups, the Hispanic population is below the rates comparing to non-Hispanic whites. So this is an example. This graph shows the influenza vaccination coverage in adults by race and ethnicity from 2010 to 2024. And in recent years, the vaccination coverage have been declining, and the overall vaccination coverage last season was 44.9%, with a goal of 70%. And as you can see, the Hispanics have even lower rates comparing to the rest of the population. So a few years ago, 2017, 2018, we conducted a survey study at FIDEC in 8 Latin American consulates in Miami. And we wanted to assess the knowledge and the attitudes toward the influenza vaccination among Hispanics. And just I want to point out some of the reasons why the community did not accept vaccination. The main reasons were that they didn't know that they had to receive the vaccine every year, and also fears. And the types of fears were fears to adverse event from the vaccine, but also fears to needles. So something that we need to consider. Some people may be really afraid of getting pinched. So take into consideration that too. So when I have conversations with patients, I think it's really important to do a one-on-one conversation. And we know that there's a lot of information in social media that is really good, but we really need to focus also in doing a one-on-one conversation. And this is the way that we can create trust on vaccines too. And so the messenger is really important. So we know that healthcare professionals plays a key role in promoting vaccines, but also, for example, if you are Hispanic and you communicate with another Hispanic, you have something in common, and you probably are gonna do a better job in regards that you are gonna be more close to that person. Also peers, for example, we have a work with students in college. When we educate some of the students to promote vaccines to other students, that impact from students to student education is also very important. Also, it's really important to listen to the patient, not just try to overload them with a lot of information. It's really important to focus on their concern. Also, when we have some challenging conversations, we try to find something that we have in common and try to make it more personal. we all want the same. We want to keep healthy. We want our loved ones to stay healthy. So let's work together to find the best way. And vaccines may be one of the ways that I can share with you. And also, when we answer their concern, try to keep it simple. I think as healthcare professional, we try to give them statistics and numbers, and maybe that's the person just needs something more straightforward and convinced that we are really saying a straight message. And we need to guide them to find a reason to change their mind and to choose vaccines. And we don't need to take it personal if after all the conversation, we don't get the result that we want, the decision to get the vaccine. So maybe you are planting a seed, and maybe next time, if you don't see, maybe you're not going to see it, but probably another healthcare professional or a family member make them change their mind and make them take the decision to get the vaccine. So it's important to be honest and talk about the benefits, but as well as the risks. I always start by saying that the benefits is that we have available vaccines that work, and that all the vaccines available prevent severe diseases. When talking about the influenza, I say this is not a vaccine that prevents common cold. This is a vaccine that really prevents a disease that is can take you to the hospital and really is a life-threatening disease. So trying to say that it helps for me. And also talking about the benefit for themselves and also for the other persons that are around us, and specifying a little bit more on the high-risk groups, because sometimes they get touched because you say, okay, if you have a cardiovascular disease, you have heart problems, you have someone that is undergoing chemotherapy. Even if they get the vaccine won't work because their immune system is weak. So I think it's important to make them understand that there are people that may need us, and maybe they have someone in their family or a close friend that is with those conditions. So maybe that keep them more open to maybe change their mind and decide the vaccine. And the risks. Talking about the risks, everything in life has a risk. You go outside and you take a risk, and vaccines that are really, really safe, and the adverse events from the vaccines are extremely low. But well, there may exist, and also as doctors we know, but we always the benefit risk always favors vaccination, and help people understand the risk. Comparing the risk perception versus the real risk. Some people may be more afraid of going into a plane and not into a car. There are more car accidents than plane accidents. So it's having in dimension what we are talking about. Help people understand the risk of vaccinating versus not vaccinating. When we take the risk of taking a vaccine, of having a vaccine, there's maybe some risk, but the comparison is not that you don't have, it's nothing on the other side. You have a virus, for example, or a bacteria that's out there in the community that is a risk. So even if you are not taking the vaccine, you're still taking a risk. And some of the examples, the risk of dying after a car accident with and without the seatbelt on. And help people identify some fears and compare the odds. The odds of being struck by lightning is much higher than the odds of severe adverse event due to a vaccine. And also explain that your practice is evidence-based medicine, that there are a lot of science behind each vaccine that we have available, and a strict monitoring process, and that you still decide, after all that knowledge that you have, you decide to recommend this to your patients and to yourself and to your own family. So making more personal. And some takeaways. The vaccine hesitancy is a time of vulnerability as well as opportunity. It's important to make it personal, but don't take it personal when they decide not to get a vaccine. Highlight that all available vaccines prevent severe diseases, and science builds on science, and we trust science. As any other medication, vaccines undergo strict safety and effectiveness evaluation even after approval. Benefit-risk balance favors vaccination. And it's important that we advise, and patients are the ones that are going to decide, but you are planting a seed, and you probably next time or in the future, something may happen and make them change their mind. So I want to just to end with a quote that I like it from Adam Brandt. We don't have to convince them that we are right. We just need to open their minds to the possibility that they might be wrong. So thank you so much for your attention.
Thank you so much, Dr. Soler. This was very informative, and at least what I take is there are many strategies that all of us can employ when we have those patient interactions and interaction with family members to plant those seeds that you're saying. So hopefully we get to benefit from that directly or indirectly.
Thank you so much, Dr. Soler. It really spoke to me. I think it's very, very important. And I will share some comments towards the end of the presentation, but very, very relevant, particularly, to primary care specialties. Now, I wanted to then introduce our last speaker, our last panelist for the evening. This is Dr. Katrina Celis. She's a member of our NHMA Florida chapter as well. She's right now an assistant professor in human genetics at the University of Miami, and she's a graduate from La Universidad de Carabobo in Venezuela. She completed a fellowship in medical genetics at Columbia University and the University of Miami. And now she's doing a lot of research focusing on genetic risk variation, molecular mechanisms in complex disorders, and advancing genetic research inclusion, particularly in underrepresented populations. She's been working a lot investigating Alzheimer's disease linked to specific mutations in Hispanic communities, and for that she was awarded the Alzheimer's Association Research Fellowship to promote diversity. So we're very happy to have you here as well, Katrina, and thank you for representing our chapter too.
Hi, can you guys hear me well? Yes. Thank you so much for having me today, and I'm very happy to be part of this panel of knowledgeable people in the field, and I wanted to kind of touch a little bit on a different perspective when it comes to vaccines and in relationship to genetics and genetic knowledge and concepts, specifically from the Hispanic population. As Luis has mentioned, I have worked with the Hispanic population specifically for genetic research for the last 15 years. And one of the things that I often hear from the Hispanic population in regards to vaccines, specifically the COVID vaccine, is misinformation in terms of the type of vaccine that the COVID vaccine is, right? So we know that the COVID vaccine is an mRNA type of vaccine, and there's a lot of misconception when it comes to what the vaccine does, what would do to my body, what are the side effects, how is this going to affect me down the line. And so was this a type of vaccine just created for COVID? Was this vaccine created because it was going to benefit economically countries or pharmaceutical companies that were generating this type of vaccines? And so the reality is that mRNA vaccines have been, it's studies and experiments in terms of using mRNA as a vehicle for vaccines have been, over 30 years of experiments and work from hundreds of scientists that started back in 1987 in working with this type of methodology. And so it was a lot of trial and error when it came to this type of vehicle to use for vaccination. There was a lot of problems with the type of side effects. It was too expensive, and it took a while to be able to use this as a method. But with COVID, there was the success was undeniable. And one of the things that I often, talk to the Hispanic population is that, the mRNA type of vaccine is a messenger type of vaccine, and the RNA and the messenger RNA worked outside of the nucleus of the cell. So it does not affect the DNA, which is the genetic information that actually it has our code, right, for what our cells do or what protein we make for specific functions that our body has. So there's a lot of misconception of thinking that if I get the COVID vaccine, this is going to affect how my DNA will work from now on. And so what I often try to explain to the population is that this is just a vehicle that is used, to generate this immune response, to trigger an immune response so that our body can't, when it's in contact with the virus, can respond to this virus by creating antibodies. So this is our barrier to lead with to deal with the disease or with the virus if we come in contact with it. And so once this is explained to them, they feel like, so it's not affecting us. It's not affecting the way our cells are going to work from that point on that we take the vaccine. So I think it's important sometimes to, explain in terms that the population can understand on how this type of vaccines work and how that would not affect, our performance, or it's not going to affect, our neurological outcome or anything else. And I think that's something that is very important. The other thing that it comes a lot when you talk to the population in terms of vaccine is the side effects. Why was this person have this severe side effects? Why this person would not have this severe side effects? So then I talked about genetic, heterogeneity, which means that genetically speaking, although we are very similar as human beings, there's differences, and there's differences between us, and there's differences in terms of, how some people get this or feel the side effects than others. And one of the things that I often say to the Hispanic population in terms of vaccines or, research participation and other things is that in order for us as scientists to understand what are the side effects or what are the outcomes of the vaccine, we need to include diversity. We need to include diverse populations. And so I often tell them, the surveys that are available for individuals, especially for the COVID vaccine, to be filled out are extremely important, because that tells the scientific community, what are the things that could be improved in terms of, the next batch of vaccine. What are the group of individuals that are getting, the more side effects? What are the specific characteristics of that particular set of groups that is developing this type of side effects? And so I think it's important to understand that if our community it's not representative in this type of surveys or does not get the vaccine, then it's hard for us to give answers to them in terms of this type of subjects. I also feel there's a lot of hesitation, specifically with Hispanics in Florida when they come from a different country, right? There's a lot of problems in terms of access to healthcare, access to insurance. They are undocumented. They don't want to get a vaccine if their contact information is going to be available, if they could be tracked, if this is going to affect something that they're in the process of getting because they're recent immigrants. So there's a lot of other things that sometimes we don't think about more than just the health aspect of, getting vaccinated. And I think that those are important things to consider for all medical specialists that work with this type of population that are supposed to be getting this vaccination. So I just wanted to give my, my 2 cents into that. And I think that it is important to have these conversations with the community and to really, explain, what is it that we are trying to accomplish as a scientist, as a physician, and trying to protect the population when it comes to using vaccines. Thank you.
Thank you so much, Katrina. Very important information. And this links with what Dr. Soler was mentioning, of us using science as well to back our message. And this is science, that surrounds all the genetics, particularly with these new generations of vaccines or that are perceived as especially during the first few years of the pandemic, that created all the idea that these vaccines came out of nowhere, and that you have all the concerns that this was just created, in a lab in just a few months, basically. So I want to just provide some final comments, and we'll answer maybe a couple of questions, and if any of our attendees have. And I was doing a little bit of research actually in preparation for the webinar as to where are we with some of the vaccination rates for some of the diseases that we were talking about, and I came across a couple of interesting things. There is a study from CDC that was mentioning that although overall non-medical settings, for example, pharmacies and drugstores, were the most common settings for patients to receive the COVID-19 flu and RSV vaccinations during the respiratory virus season, particularly this last one, most Hispanics received particularly their flu shot in medical settings. So very interesting, when you talk about the Hispanic population and the trust that they may place in the provider, in the physician, and the opportunity that we have in that moment in the office when we see the patient of engaging with the conversation and saying, hey, promoting the vaccine at that moment, because that is the opportunity of saying, hey, you are here, you already came to the office, why don't we do it now? It may be difficult for the Latinos in our state, particularly, we're so busy, they may be working very long hours in jobs that may not provide them with the opportunity for them to take a moment to go to the pharmacy and so forth, or they may not have, and of course, that should be the case at least, that the level of trust that they have with you, with the relationship that they have with you, is going to allow them to navigate any kind of concerns or hesitancy that they may have around the vaccine. Now, in regards to the meningococcal vaccine, just today, actually, a study came out in JAMA, this is JAMA Network Open journal, about quadrivalent conjugate vaccine and invasive meningococcal disease in U.S. adolescents and young adults. And I, make a caveat there that is on the quadrivalent vaccine, but very interesting findings that I just want to summarize. And it says that between 2005 and 2021, the quadrivalent vaccine program is estimated to have prevented 500 cases of invasive meningococcal disease and 54 deaths among individuals aged 11 to 23. Without the vaccination program, the incidence of invasive disease in this population would have been at least 60% higher. The vaccination rate, however, with at least one dose of Menactra of the quadrivalent disease in adolescents 11 to 15 reached around 80%, but those eligible for a booster dose, the coverage was lower with an uptake around 60%. And this is not counting the MB vaccine. So for sure, we still have, not only we're seeing the effectiveness of the vaccine, and this is the quadrivalent. Imagine if we put together the data and we add the fifth serotype. So we can really make a change and prevent deaths in this young population that we have in our country. And finally, talking a little bit about RSV, in the 2023-2024 season, only 10% of the eligible population in Florida, so patients over 60 years of age, got the RSV vaccine. So this, again, focus on the idea. And overall, throughout the nation, the coverage for RSV, the uptake of the vaccine was fairly low. But I must say, as part of our Florida chapter, Florida unfortunately ranks among the lowest states with vaccination rates in the US. So we do have to continue working on this and expanding the message, putting the word out. And I sincerely thank all of you, all of our panelists, and Dr. Pérez-Stable for joining us, and for NHMA as well for providing us the opportunity to reach out to our community. And maybe we can go to a couple of questions that our audience may have. I know we only have a few more minutes. And I think I have one here from Joseph that Alicia already answered as well a little bit on the chat, just in case anybody else has any further input. So it was about how do we approach any parents who are adamant that their child doesn't need the vaccine due to being homeschooled? What can we do in those cases? Any suggestions?
You know, I responded that even though they are schooled at home, you know, I would hope that the child is still being socialized in some way. And that is, you know, when any kind of social behavior, the interaction puts that child at risk.
Definitely, definitely. And I actually have one question myself in regards to meningitis. What about cases in adults? So we have patients who are also immunocompromised, you know, for whatever reason it may be, or maybe receiving a transplant. And I know there are different populations.
Yeah,
but
there are a lot of at-risk populations, asplenia, and right now even there's an outbreak, you know, among adults. So
correct. So there was an outbreak in Florida, I believe, not that long ago. That you know, we got the emails, the alerts from the Board of Medicine from the health department.
Right. You know, unfortunately, we don't have vaccination guidelines for adults. It's licensed. I can tell you that I've received it, and so
it's very tricky, right? So it's still about, again, bringing the awareness on the importance of the vaccine, especially for these cases of immunocompromised, asplenia, for example, or any condition that leads to that.
Right.
Thank you. And Katrina, I had a question as well for you in regards to the COVID-19. So many times, you know, we hear about with COVID and flu and so forth, like the different viruses, like, why do I need to keep getting the vaccine? Why are they still coming with new vaccines? What's going on? And we may know, you know, that it's associated with the mutations that the virus experiences, etc. But any suggestions on how can we tackle this conversation?
Yeah, that's a great question, actually, Luis. You know, some of the things that I explained to them is like, as viruses, they have the ability to change, right? And so they change based on resistance, based on, you know, the season. They mutate, right? They change. So one of the things that I often say to them is, you know, we need to keep updating these vaccines because the virus sort of change their game, right? And I try to explain to them that, you know, as the same way our immune system changes often because our immune system tries to fight different viruses, bacteria constantly in a day, the virus do the same. And so that's a way that I usually use to explain to them that this is the reason why updated vaccines happen and why we need to do it when they come, you know, with a new updated version. And that usually is taken well by the population, as long as, you know, you tell them, you know, your immune system is your line of defense, you know, and you often have to change your line of defense depending on who you're fighting against, right? And so that's sort of like the idea and the train of thoughts that I use to explain to the population why we need to update vaccines.
Perfect. Thank you. Thank you so much, Katrina. And in just 30 seconds before we go to Serguei for some final remarks, I over the past few months, I will say, I have become so much more passionate about immunizations, their role, the influence that they have in the community. Even though I'm internal medicine trained and I actually am a faculty of our residency program, I think we still have an opportunity to expand education. I don't think we still need to focus, and not only on the book knowledge of this, you know, that knowing when it is indicated and so forth, which is of course important, but also about the conversation. So how can we engage with the patient on this? Because it of course, having the conversation, at least bringing it up, is going to make a difference. If you don't bring it up, then who will? You know, you're going to leave the message to the world. But also, it's just like with mental health. You know, you have to take the moment, the time to talk about it, discuss it, and reflect upon what the patient is saying. So have that, for example, there are some techniques on motivational interviewing that you can use and just listen, reflect, provide information, and go from there and just walk with your patient throughout all of this. And as Dr. Soler was saying, you know, they are the ones that make the decision, but you are providing information, accurate information, and guiding them through the process. One thing that I started doing in my practice was actually, rather than necessarily starting with asking, like, hey, would you like to get the flu vaccine, or would you like to get any vaccine, is, you know, today is time for you to get the vaccine. And it's, even if it is a tiny change, you know, I personally, I've seen a difference, you know, that it's taken in a different way. Rather than, if they have concerns, they will verbalize the concerns, of course, you know, and then you go along. But at least I think it makes that different moment that say, hey, you know, we are getting ready the vaccine for you. We'll continue moving along. This is the time for your Shingrix, whatever it may be. So please do, for all of our attendees, please keep this in mind. This matters. This can change lives. And I think I have a question there from Joseph. What are your thoughts on involving workforce managers and HR departments in the importance of worker health for our community? I've seen a lot of success in workers who actually wanted to get vaccinated after conversations with their boss. I'll keep this open to the panel if anybody has an insight. I just saw something like this when COVID happened. I remember that we were asked to have a conversation, not necessarily in the context of managers and you know, employees, but physicians with employees. You know, like we had like open forums within the organization trying to put out the information about COVID vaccine, what it means, why it was important to get vaccinated. But at least I haven't had experience, you know, with managers providing this information besides any particular mandate that an organization may have on certain vaccines. All righty, then Sergei, maybe you can give us some final remarks.
Very good. So I think we went through lots of very useful and very important information tonight. I'm so glad we had people with so much experience, so much heart, and loving what they do. Absolutely, I could say it, and we're very fortunate to have them tonight to learn from them. We'd like to expand what we're doing to even a larger community, and we invite all of you to join the 28th annual NHMA conference. It's called Uniendo Voces, Advancing the Future of Latino Health. It's going to be in Anaheim, California, from March 20 to the 22nd next year. And we invite you to join us for the premier event for Hispanic medical professionals, shaping the future of healthcare. So you could be part of that. And it's a very vibrant group of people, like-minded, trying to help the communities, trying to help their colleagues. And we invite every single one of you to join us, directly the Florida chapter and the national organization as a whole. So thank you so much for your time. We really appreciate that you're taking this effort and time out of your busy lives to learn more and help more. So really appreciate it.
So thank you all. Remember, there is a QR code that you can use now to complete a brief survey that we have. And we want to get more information as to why, you know, the content that we want to provide to all of you. Thank you, really, all of you for joining us. And you can also join the NHMA Vaccinate for All Champions. As we were saying earlier, it is essential for all of our members, for you can make that impact in your community. So become a vaccine champion. And NHMA has this beautiful campaign so you can be part of the community. So you can start that QR code. It's going to take you through the websites that we described at the very beginning. And in just a second, we're going to show you as well the QR code for our survey, which will also be emailed. We want to get your feedback, and you will enter into a raffle to get some prizes. We really need that insight. Remember to follow us on social media at NHMA MD. Remember to follow your Florida chapter and NHMA Florida. And if you are not a member yet, please do become a member of NHMA. We are here in this together. We have the power to make a difference. We gotta stand for each other. We gotta help our patients and help our professional or our community. So thank you everybody for joining, and have a beautiful evening.